been a lot of discussion around the health exchange today, and I just want to kind of frame it for my colleagues from what the alternatives or what the options are that are before us. The federal government, HHS, has come out with a blueprint. This is after the passage of the Affordable Care Act. And that blueprint specifies 3 different options for people to pursue, for the states to pursue. One is a state-based exchange, one is a partnership exchange, and the other is a federally facilitated exchange. The common ingredient on all these different exchanges, besides the word exchange, is the fact that the states have no control in how those, or the policies associated with each of those different exchanges where it matters most, and that is around the actual health care that's offered to the citizens of the state of Michigan. Yeah, I don't care about bureaucratic policies on how you run your call center or anything like that. What I care about is what happens to the people that are supposed to be cared for as a result of this health insurance, and there is no difference in any 3 of those options in that regard whatsoever. So I want to highlight and agree with my colleague from the 13th District here in that we should not be running the complaint department for the federal Affordable Care Act at all. And the supplemental that's going to be discussed coming up here has 3 different components to it, 3 main components. It's got plan management component, which is kind of a minor portion of it. It's got a $19 million is for these consumer assistance personnel, which, by the way, is a one-time grant. We pick up the bill afterwards. These are people that are going to be hired to man these complaint desks. And then the last part is for an IT fix, which I would submit we've got $47 million worth of IT project fund in the budget from last year, and also we're looking at doing a similar budget this year. We've got projects in the queue that can help manage a lot of those interfaces right now if you just adjust the specs to sync up with it, so we don't need this supplemental that's going to be coming down the train. It's a bad deal for Michigan, and I'd be welcome to talk about exchange options that actually do benefit the citizens of Michigan, and I think there is some room within state-based exchanges if we went back to some proposals that were taken off the table when we were talking about the Michigan health marketplace, something that would preserve a degree of free market accountability on it, but that wasn't discussed and that wasn't on the table, so we're left with what we have right now. So I encourage everybody to be wary. When you read the fine print on this, we get to do all the do all the puppet work, but the puppeteer is sitting back up in D.C. They make all the rules.